Hello, everybody. Again, this is Dr. Kamel and a new content related to the physical therapy license exam preparation. My name is Dr. Kamel, and I work as an associate professor of physical therapy in the United States. And I am a registered licensed physical therapist as well. Okay, so let's go for today's content and see what is the content is about. A physical therapist is conducting a reflex test as shown in the photographs. Okay. The arrow indicates the path of the applied stimulus. So we start, you know, here and go this way. The results of the test are most likely to indicate this is we can see what is happening here. Extension maybe of the toes. This is a peripheral nerve injury. This is might be a lesion of the anterior horn cells, which is mainly motor. A normal response. This is extension is a normal response. And injury to the spinal cord, which is number four. Yeah, the picture is not very clear, but is close as much as we can. So, what is the answer for this question? Actually, this is a test. This is one of the special tests which we study in neuro, and this is called Babinski reflex or Babinski sign. Some people say Babinski sign, and this indicates an injury to the spinal cord. This response which we are seeing in this picture indicates there is an injury to the spinal cord. So what we can see in this photograph. Uh, the examiner is stroking along the lateral border of the foot, starting at the base of the heel and going up and toward this area, from the heel toward the forefoot, and then medially across the ball of the foot. And the arrow, the image shows that this classic stimulus pathway. Okay, so what we have seen in this picture. Okay, so if this is negative or we have a normal plantar response, what should happen? Flexion. You know, we can see flexion of the toes. Okay, but if we see here that we have abnormal response, what will happen? The great toe will be upward and smaller toes might fan out. Okay, so again, normal response, flexion of the toes. Okay, abnormal response will be extension of the big toe, fanning of the toes. And again, the examiner can do that using the hammer, and in order to scratch and test the for Babinski sign or blunter reflex. So in this question, what they are asking you about, they are asking you if you can recognize if this is a positive or negative Babinski sign. And actually, we need to go further and understand when Babinski sign would be positive or negative. So if the great toe, dorsiflex or extends upward and other toes fan out, this is abnormal response, and it would indicate this is upper motor neuron lesion. And we will differentiate between what is the meaning of upper motor neuron lesion versus lower motor neuron lesion. And this upper motor neuron lesion especially will involve corticospinal tract and spinal cord pathways. Corticospinal tract and spinal cord pathways. And we talk about these pathways in neuro as well. So this is a correct answer. This is an injury to the spinal cord. Option number four. Okay. Again, in adults, this might indicate a corticospinal tract dysfunction, upper motor neuron involvement, spinal cord pathology. The common causes could be spinal cord injury, could be a stroke, could be multiple sclerosis, could be brain injury, could be any other upper motor neuron lesion. So for the exam or for the sake of exam, we need to identify that positive Babinski sign means upper motor neuron lesion. Okay, and so this would be the best answer as a spinal cord is required or is considered part of the central nervous system and could and will contain also the spine the corticospinal tract. Let's look at the incorrect answers. A peripheral nerve injury? No, this is not a peripheral nerve injury. If we have a peripheral nerve injury, we might see lower motor neuron signs, okay? Like hyporeflexia, flaccidity, atrophy, fasciculations. Okay, but Babinski or positive Babinski sign is not associated with peripheral nerve injury, actually. So again, just to confirm, this plantar response evaluates central nervous system integrity and corticospinal tract function. Another incorrect answer, a lesion of the anterior horn cell. Anterior horn cell lesion is a lower motor neuron lesion, and we have several diseases which would affect the anterior horn cell, like poliomyelitis, spinal muscular atrophy. Poliomyelitis is a viral infection. Spinal muscular atrophy is a hereditary disease. But we would find different findings like decreased reflexes, muscle atrophy, weakness, fasciculations. So again, positive Babinski sign is an upper motor neuron sign. So this is an incorrect option. And the last incorrect option is this is a normal response. No, this is abnormal response, which we have seen. The normal response is downward curling, is plantar flexion of the toes. But here in this picture, we have seen extension of the great toe and fanning of the toes, and this is considered abnormal response in adults. In adults, but we have one exception here. We need to also clarify that Babinski sign could be normal in infants under the age of 1 to 2 years because still the corticospinal tract is not fully myelinated or fully matured. Okay, but in adults, this response is abnormal response. Okay, so last note, how we can differentiate between upper motor neuron signs and lower motor neuron signs. Upper motor neuron signs, we will see hyperreflexia, spasticity, clonus, positive Babinski, increased muscle tone, versus lower motor neuron signs, hyporeflexia, flaccidity, fasciculations, and atrophy. And the take home point again, in a positive Babinski sign, the toes will flare and the great toe will dorsiflex or extend. Okay, and this indicates positive Babinski sign, and it is an indication of upper motor neuron lesion, such as spinal cord injury, which is option number 4. That's it. So if you would like to join my BT license exam preparation course, please drop me a message on this WhatsApp number 0014424872006 or 002017743702. Also, if you would like to apply and join the DBT program at University of Montana in the United States, an online program, we can get you a discounted rate. You to join in a message on either these WhatsApp numbers, and I will send you the details, the requirements. And this course is mainly for people who are in their last year or internship time, so they are preparing for their exam basically. And the DBT program for people who fully graduated and they have finished study their BT program. Thank you for watching me. I would appreciate if you can share that with your friends and colleagues. Will be much appreciated and see you soon in a new content.